Hello, my name is Jay Huang. I'm a fourth year pathology resident in the United States. I go over cases almost on the daily from head to toe across different organ systems. If you're interested in that, consider giving me a like and subscribe. Without further ado, thank you to Pathpresenter for this case of an esophagus case. And this will be eosinophilic esophagitis. Okay, let's see the clinical history. This is a 15-year-old female with history of dysphagia. All right, so what we see here is we see fragments of esophageal epithelium, and we can see from low power that this piece of esophagus is basophilic. It's busy. It's not pink. Rather, it has a lot of spongiosis. And as we delve closer, we have eosinophilic microabscesses, which are 3 to 4 eosinophils clumped together. So this is going to cause the patient a lot of discomfort. So in addition to spongiosis, we see eosinophilic microabscesses. Oftentimes you'll see lamina propria fibrosis, and clinically that's indicated by like the tugging sign where the endoscopist really has to tug at it and it can cause bleeding. You can also see some trachealization or felinization, where the esophagus looks like the trachea of a cat. Don't tell me how that came out to be, but I mean, that's just one thing that we had learned. I don't see a lot of lamina propria fibrosis, and that may be because they only got a superficial sampling of this esophagus. But that's another telltale sign. And then once you see EOS, most times you won't see a rip-roaring case of eosinophils like this. Rather, what you would do is you go to high power field and look for the hot spot, meaning the area that has the most eosinophils in the epithelium, and count how many eosinophils there are. Greater than or equal to 15 eosinophils per a high power field is very suggestive of EOE. The reason we count is because in GERD, gastroesophageal reflux disease, you often also have eosinophils, but those are more found in the distal esophagus, whereas EOE is found in the proximal esophagus. And another reason why we count is it also tells us how they respond to treatment. If they don't respond as well to treatment, they might increase the dose. So here, I'm not going to even count. There's more than 15. One of my staff, we asked him, who's GI fellowship trained, we asked him, like, what's his threshold for us to stop counting? And for him, he said a good number is 50. Once you get to 50, you won't change the management by counting more than 50. And it takes time to count more than 50. All right, so let's look at what they mentioned. Increased intraepithelial EOs, yep. Eosinophilic microabscesses, yes. You'll also see basal cell hyperplasia and intercellular edema. So here we see some basal cell hyperplasia. Macroscopic features, you'll see concentric rings or linear furrows, white plaques or exudates, and narrow caliber esophagus. So this is a case of EOE, and I hope you enjoyed the case or learned from it, and I'll see you next time. Bye.